75 years, the Andrus Children's Center has remained a family-oriented organization that gives opportunity to the youth of Westchester County and the tri-state area. The group defines their work as more than just a service to help families deal with major solutions, but help children be valued and nurtured. Joining us to speak today from the Andrus Group, as well as talk about his recently published book, Destroying Sanctuary, is the Chief Operating Officer, Brian Farragher. Brian, welcome to the show.
Thank you for having me.
All right, so let's talk a little bit about the organization. Tell me what your goals are. What are the goals of the organization?
Well, the organization, which was established about 82 years ago by John Andrus, who was a philanthropist in Westchester County, he established it to give opportunity to youth. That was his catchphrase. But it began as an orphanage to help children who were sort of disenfranchised and didn't have a home. Over the years, it has evolved into a mental health facility. So we serve children on our campus with significant mental health issues. But then we've expanded into the community. So we do a lot of prevention work now, really try to help kids stay on track, stay on the right track, and have productive lives.
And from what ages are usually treated at the facility?
We serve children in our community programs from birth. We have a home visiting program that we do. And then on our campus, we serve children as young as 6 up to about 15 years of age. In our mental health clinics, we serve children, from 2 to about 15 years of age.
I assume the children are residing at the facility?
In some of our programs, yes.
Okay.
We have a campus where we have 73 children who live there, and we have another 80 children who come in for day services, and then we have probably about 1,500 children that we serve in our community programs and our mental health.
Well, how does a family find you? Let's say they have a child who's mentally disabled or something that they need treatment for their child. How would they necessarily find you? Or do you go into the community looking for them, or are you somehow putting notices out to the community? How does it work?
Well, we do a lot of work with schools in the area. We do a lot of work with the special ed programs in the city and in Westchester County. We also have a website, which is andruschildrens.org, which is a way to find us. And then we do these kinds of things too. We do presentations. We go out and speak in schools and in the community and tell people about our services, and also tell people about mental health issues with children.
Well, let's talk about some of the services. Let's talk about some of the things that you provide to a child who comes. From morning to night, what kind of things are they experiencing once they're there?
Well, it depends again on the program. So as I mentioned, we run probably about 15 to 20 different programs. So we have just school-based mental health, where a kid gets counseling.
Okay. That's a one-on-one.
That's a one-on-one. We have mental health services in the community, same thing, counseling, individual, family, group therapy. Home visiting programs where we're teaching parents how to better parent their children. The more intensive services on the campus, which are the 24-hour residential programs, is the children get up in the morning, they have a very structured day. They go to school like all children. And throughout the day, they're in much smaller classes, so they have classes, no larger than 8 children in a class. And they get a lot of counseling support, a lot of crisis intervention services, a lot of help with managing their emotional world and so on.
I was looking at some of the research. I guess some of the kids who come through have, autistic tendencies or, situations. We're starting to see, or at least I'm starting to see, so through some of the work that I see in the community, it looks like some of the children that, that are probably coming to your facility are being treated for some of the autistic type of tendencies. Does that seem to be the case?
There's an increasing number of children who we're serving on our campus who are on the autistic spectrum. So we've done a lot of training with our staff to get them up to speed on that. We use applied behavioral analysis in our school with kids on the autistic spectrum. I'd say right now, of the 150 children we serve in our school, I would say probably about 30 or 40 of our children are on the autistic spectrum.
That's a fairly big percentage.
Yeah.
Are you working with the speech, trying to help
Yes.
them talk, a little bit earlier? I know there's a prompt method and different methods to help them.
Well, most of the children that we serve, for the most part, are not severely autistic children, so they have language, but they need a lot of help with social skills, a lot of help with sort of behavioral modification and those kinds of issues.
Let's talk a little about the book. I
Sure.
found that's interesting. How did you decide to get involved with the book?
Well, we began about 8 or 10 years ago with working with Dr. Bloom. Sandy Bloom is a psychiatrist who works in Philadelphia. And she's developed this thing called the sanctuary model. And it's a model of care that really is about, it's really trauma-informed. So it really talks about the impact of trauma on people. So we've been working with her for the last decade or so. So the book we wrote together, Sandy and I collaborated on the book. Sanctuary is really about developing an organization that is healthy enough to help people who are struggling. So very often what happens in our environment is that the effect of stress doesn't just affect kids and families, but it affects staff who work in organizations, affects the whole organization. So this book is really about what's gone wrong in our system. The mental health system and the human service system in our country and our society.
Well, what has gone wrong?
Well, I think what has gone wrong is a lot of economic and social forces that have really put lots of pressures on organizations that are supposed to serve people. So they're, even in the most recent, issues with the state budget, the impact of sort of cuts, budget cuts, funding reductions has been really significant on programs like ours and all kinds of nonprofit and human service programs. It creates a great deal of stress in terms of just meeting compliance rules, but also dealing with really, really troubled people who have had really significant injuries in their lives. So that impacts, not just the clients themselves, but the whole service system. And so what we talk about in this book is what those cuts, what those changes, what that sort of deterioration has done to the system, and really in large part to the people who are supposed to be served.
From a
by
legal
us.
perspective, because I sometimes come at things,
Right.
thinking as an attorney, are the courts sending you children because they're coming from homes that are broken, or there's some type of abuse that's occurred between the families? Are you sometimes seeing children in that?
There are many kids. It is not every child that we see, but yeah, we have a lot of children who come through the child welfare system where they've been the victim of abuse and neglect. But I think there are all kinds of things. There's community violence. There's domestic violence. Even if the child themselves hasn't been abused, they've been exposed to all kinds of violence and disruptions, loss, all those kinds of issues, and that has a significant impact on kids and their development.
I would probably think that this would be an ongoing situation with a child, and it follows them for many, many years. But in your experience of doing this, how quickly do you see a turnaround? When do you finally start to see the child's coming out of the darkness that usually engulfs them from something like this?
It really depends. I think the children are incredibly resilient. They're still forming, so there's opportunities to really change the trajectories of their lives. And so I think very often it depends on the quality of the relationship between the child and the helping professionals. But I think for many of our kids, we see changes pretty quickly, not necessarily deep change, but we see changes pretty quickly once they're in a structured, settled environment. They begin to have the foundation for making more permanent change.
And so it's not just psychotherapy; it's also medication. Am I correct?
We use psychotropic medications in some cases. Yes.
So give us a success story, and let's make us feel good a little bit about what's going on there. Any particular, kids or things that come to mind that go on there that just make you feel good about the kind of work you're doing?
Well, we had this, a recent story was we had a young girl who really had a lot of difficulty, very, very aggressive, very violent child, very assaultive, and ended up being hospitalized many times, because of her, really unbridled sort of aggression. When she came back from the hospital most recently, we really put a plan together for her that really worked with her on her affect management skills, really taught her these skills. She worked very closely with one staff person, developed a very good relationship with her. And also she was a kid who was really just a nuisance, was a pet, a bother to all her peers and to the staff.
She ended up working with this staff person to do some cooking. So every day when the kids came back to the cottage, she had prepared their snacks. So she had baked cookies for them, and so she became a more popular kid because of her cooking skills. But in about a 2-month time, the turnaround for this child was incredible, to the point where she moved to a level that we call an achiever, which means she can have some unsupervised time. And she said that she wanted to become an achiever because she wanted to be out helping other kids. So she moved from a situation where she was somebody who was, really sort of very destructive and very aggressive, to a kid who is now helping other kids, and that was pretty.
So I guess
impressive.
you don't really know. Each child is different. It could be 2 months. It could be 2 years. But
Right.
But when you finally see it turn around like that, it probably is just such a rewarding experience. Who knows? This girl might go on to become a chef or something in that field.
Well, I think what we talk about all the time in our plays is that for many people, their past define their future. Right? And what so a lot of our kids come in, they think because they've had past troubles, that's the way their future is going to be. What we want to try and always create for our kids is a sense that their futures can be different. All right? That they can do some things that we can help, but they can make decisions, they can make changes that will change their futures.
Okay,
and that's crucial.
All right. Now we don't have that much time left. So
Sure.
let's say there's somebody who's watching today, and there's an issue in the family, and they want to get their child some treatment. How do they contact you?
Well, they can call our main number, which is 914-965-3700, and we have an admissions person there, or staff who can talk to people who have questions. We also have a website, which is the andruschildrens.org, I'm not big up on social media, but I think we also have a Facebook page and so on.
Everyone has you have to be on Facebook.
So I'm not on Facebook yet, but we are also on Facebook.
Last tips or advice you want to give to somebody who's watching?
I think the one thing I would say is that we deal with some very troubled kids, but I think I believe that there's always hope. There's people who people have had a lot of troubles, and just because a kid has had a tough life or is creating a lot of disturbance in their school or at home, it can improve. People who get help, who get intervention, can make necessary changes in their lives.
Brian, I want you to know I think you're doing a wonderful thing to the community, for parents, for everybody, and maybe you can come back and share some more success stories.
Be happy to.
It's nice seeing you. Thanks for coming.
Thank you.